new normal, and we can share with you, of course, our guidelines. Uh, I just want to make known to you that this was for the GCQ and ECQ, but this afternoon, I think you heard of another term, which was the modified ECQ. But whatever it is, this still applies. So let me share with you these guidelines and a brief background on the guidelines. Of course, it will start with the declaration of the public health emergency, which was done last March 8th, and then we had the Luzon-wide ECQ last March 16, which should have lasted until April 14. Then on April 7, there was an extension. Then actually there have been further extensions, but on April 23, there was a recommendation by the Interagency Task Force that guidelines should be issued by the different government agencies to provide policy directions for public and the public and stakeholders. Can you hear me? You can hear me, in
Yeah,
complying
very loud and clear. Yes.
with government regulations following modifications of the ECQ.
Yes.
So the main objective, of course, of these guidelines, and here really we really work together with the DTI, was to assist private institutions allowed to operate for both the ECQ and GCQ in developing their minimum health protocols and standards in light of this COVID-19 pandemic. This would apply to all workplaces, to employers and workers in the private sector. And it is very important for all of you to know that these guidelines were aligned with the DOHAO, the Administrative Order 2020-15, which is the guidelines on the risk-based public health standards for COVID-19 mitigation issued by the DOH last April 27, 2020. And aligning it to that, there were four main strategies in these mitigating measures for COVID-19 in the DOH administrative order, which is increasing physical and mental resilience, reducing transmission of COVID-19, minimizing the contact rate, and reducing the risk of infection from COVID-19. So coming from all of these major strategies as defined by the DOH, we of course now adopted these guidelines into this DTI DOLE guidelines, and detailing each and every strategy. And I think most of you would already know this by now, that when we talk of increasing physical and mental resilience, this is really looking at our healthy lifestyle, looking at nutritious and well-cooked food. You know, in the beginning of this pandemic, it said that raw food should not be eaten. And then, of course, we continue to advocate drinking plenty of fluids, especially now with the temperature and with its increased temperature outside. And of course, avoiding alcoholic beverages, having adequate rest, and at least 8 hours of sleep, and exercising regularly. We cannot overemphasize and keep on stressing the importance of resistance of our immune system so that we can battle this disease. And of course, it is also, it is good, and it is written here that we enjoin companies to provide free medicines and vitamins if they can, and that there is a referral for workers needing counseling or presenting with mental health concerns. The anxiety, the fear arising from this disease is really, it overwhelms everyone, and it does not spare our workers. And just before this, we already passed the department order for the mental health programs in the workplace. Hopefully, if companies already picked up from there, they would have one, capacitated some of their personnel for counseling, or at least they already looked into a referral system, which is really so much needed, more so now. Now, on the second strategy of reducing transmission of COVID-19, we have divided this into first the prior to entrance, and of course, when you're inside the workplace. It is very important that we isolate, because that is, the transmission is something we do not like. We would like to stop. We do not like that there would be an infection, and we would really, really want that for those who are not feeling well, for those with symptoms, for those with fever, at the start pa lang, or even before they should stay at home. But if there is any, if they do not notice anything, but upon getting in, just before entering the workplace, we would also like to have some mitigating measures. And of course, we would always say masks. It is now the new normal. Everybody will wear masks. It is required, the interagency required, that in all, going out of your house, masks should already be worn. This does not differ in the workplaces. Cloth masks can be used, reusable masks. And then, of course, just before you enter, and this has been the norm now, you would have a temperature check and recorded, and there would be daily questionnaires. These daily questionnaires would pick up how the person is feeling, how the worker is feeling, what the exposure was. Actually, when you do the questionnaire, please look at, have it answered looking even back to 14 days, because that is so important, because that is the 14-day incubation period. That's why they always say, did you have any symptoms 14 days prior, or were you exposed to anyone, or the possibility of an exposure to anyone who might have symptoms even 14 days prior. These are daily health questionnaires, because if you would answer yes to any of this, and you have also a temperature, an elevated temperature, at that point you're not allowed to enter. And that is why an isolation room, even there already in the premises, within the entrance premises, is very important, so that you do not go in, you do not unduly expose anyone else nor any areas at work. Now, just before you go in, it is also now part that we should have disinfection. Now, I would like to look at the new normal as, it's just 3 letters, MDD: mask, distance, and disinfect. And this would already give us, at least that protection, because this is really what is needed. I mean, this is not the only things, but these are already important activities, so that we can lessen the transmission. Next, that's me pala. Okay, now when you enter, yeah, still prior to entrance, if there are vehicles, because there will be shuttle services for operations or in plant, or those with plants, like the settings where there would be manufacturing plants, there will be equipment, there would be transportation, and all of this would need to be disinfected regularly. As soon as they enter, there would be disinfection. If they go out again, when they enter, there should be regular and frequent disinfection. And because we know that, prior to entrance, there would really be queuing of personnel, then physical distancing should, of course, be always observed. They have asked us here, because, when you enter a building, you might have 1,000 or so many thousands. Would it mean that they physically fill up the form there and then? We already gave our if our opinion here, that if companies can have an online apps where they submit it just before they leave the house, or they submit it already, because those are the health symptom questionnaires that must be accomplished. But there should be a system, so that those who should be receiving that, they will be flagged if there would be any symptom that they should monitor for. And then it was also asked, then how about the temperature check when they get in? Once it's recorded, again, if they would have that apps already for them to write down or to text in the temperature, then it's recorded. But really, when you have an elevated temperature and we're screening at very early at 37.5, then you will be isolated, so that you would be further assessed. Now, inside the workplace, we have what is known as the frequently handled objects: doorknobs, railings of stairs, for the elevators, the buttons, and anything else that are frequent, even surfaces of our tables or other conference tables that are going to be used. It is now required that they should be cleaned and disinfected at least once every 2 hours. So all these work areas and frequently handled objects should be disinfected every 2 hours. And in toilets, there should be sufficient clean water and soaps, and the frequent hand washing. It cannot again be overemphasized. It is really very important because our hands touch anything and we go to place and we truly touch anything. The best way to sanitize our hands would be through frequent hand washing, and of course to avoid touching our face. And it would also mean that, so that there would be frequent disinfection, that the sanitizers would be present in corridors, conference areas, elevators, stairways, and other areas where workers pass. Physical distance of 1 meter, radius, front, side, and back is the minimum. We have heard so many already that say the new minimum now is 6 feet. Then fine, if it's good, then that's good. But then there really are workplaces where it might really be so difficult to observe that 6 feet. And that's why we said on a minimum 1 meter, front, side, and back. But you should have all the barriers also, like the mask. And if you can add other physical barriers, that would be helpful as well. We have discouraged communal eating because that's the only time you bring down the mask. Because even when you talk to other people, and even in BPOs, we were asked when they talk to clients, because it's their personal microphone anyway, will they still have the masks on? Yes, because you take off your mask, you have secretions. Again, there's so much unknowns here. You have asymptomatic carriers. You do not know if, and then the secretions would go not, even to the tables and other surfaces. And if you are asymptomatic or you're a carrier, then somebody touches that area, that you can now understand why we would like that when the masks are off, it's just, for eating. And right after that, you clean the work, the work area, you clean your dining area where you ate, dispose the waste properly, and then wear the masks again. We should ensure that physical distancing is maintained, even if you eat in dining areas. If you cannot eat in your own individual workspace, if it has to be in canteens should still provide that physical distance. They should observe that physical distancing, 1 person per table. But if it is a long table, then of course, then you can have many others with you. But again, observe and comply with the physical distancing. Do not converse, just eat and wear the masks again and go back to where, to your own workplace. This is really difficult now, but we really are doing everything to prevent transmission or the spread of whatever would bring about this virus in any workplace. And that's why we also want that even in these kitchens, canteens, cleaning and disinfection should be done frequently and regularly, even to the equipment, the appliances in the kitchens or canteens. To minimize the contact rate, we're looking at alternative work arrangements, which would mean shift work, staggered work, work from home. I was thinking, in modified ECQ, where work is already permitted for some, but it's modified, there would still be some ECQ areas and some where the ECQ might be a little bit more relaxed. I think if you heard the way it was explained earlier, there would be buffer zones, there would be containment zones. So if you're allowed this, where you would have at least 50%, you should still observe physical distancing. And the 50% is already a skeleton workforce. And besides, what would also add on to this would be the transport system, where it is not a fully operational transport system. Passenger capacity is still restricted. So you will not have a transport system that would support many workers. You will really have a transport system that will be, available for a reduced number of workers. And that is why we keep on appealing to companies that they should still provide for that work from home arrangement, especially because there will be those most at risk, the vulnerable population that will resort to these work from home types of arrangement. Shift work, staggered work, so that you have less people at a certain time. These are other working arrangements that, of course, can be resorted to. We also discourage prolonged face-to-face interaction, and if it does have to happen, your masks should still be worn between workers and clients and among workers themselves. So that's why masks should be worn minimum with there should be meetings with minimum packs. It's not anymore filling up a conference room. There's still physical distancing. That's why you really keep the participants to the minimum and of short duration. It has been asked of us, how short is short? Well, from my personal experience, when we had to have a meeting with a big group and suddenly there was a COVID positive person there, the meeting had to stop. The DOH gave us, provided us with a mechanism which said that if we wore masks at that time and we were just there there was no contact, or if contact was there for less than 15 minutes, then that would be okay. So how short is short? If I use that 15 minutes with masks on, would be considered acceptable.
Okay.
Anything longer than that would then use video conferencing, because everybody knows how to use Zoom. Everybody's using them now, and it does work, and we all know that. Now, in the office layout, of course, office tables should be arranged so that there you will observe physical distancing. Or sometimes they say, the work arrangement should be like every other worker alternate, so that those in the middle tables would be not present when the other workers are there. We leave that up to you, but these are, of course, ways and mechanisms so that you will still provide physical distancing in the office setting, and unidirectional flow of movement, one way, so that there is no face to face. It is still better that we have a one way type of direction, and including in the use of stairs. If there's one stairs only, then look at it where one half would be going up, the other half would be going down. But if there would be two stairways accessible in any workplace, they might want to look at one of these stairs to only be used for those going up, and the other one for those going down. For enclosed places, even physical distancing should be observed in elevators. I remember the first time we talked about this when we were together in PCOM, and it was really, COVID was already there. Then they were talking of elevators. We didn't. It was not. We thought it would not be a big when at that time, but now it's really an issue where we are really complying, and we have to really observe very well the physical distancing measure. Okay, so the stairs I have discussed. Now, if you have clients, there are many offices that would have clients go, like even in the DOLE, we would have clients who would come to us. It is now best to use system where there would be an online approach, or so that they can log in. Or their requests, or even on a real time, there is someone there to answer them, but it is going to be online. Roving officers is written in the guideline, but this can refer to our safety officers. They should be the ones to monitor and ensure that there is physical distancing, and that they should observe all the other health protocols, like the use of masks, the regular disinfection of frequently handled surfaces, and even reminding the workers of frequently washing their hands. Now, reducing the risk of infection. Even if we try to isolate workers, even at the entrance, but suddenly if someone would feel unwell, we would like that there are already protocols set. there were questions asked of us when what do we mean by an isolation room? Would, if you're in a multi-tenanted building, would it mean an isolation room in every office, in every store? What we're saying is the isolation room should be, within the entrance premises, or in that area, so that they really will not, I mean, again, it's so that they're not brought, the person will not go in if they have to be assessed because of symptoms. But if there's also one who suddenly feels unwell, then he would go there. We do not like to that they use the clinic or any clinic, because many other workers also use the clinic, and they're also clinic personnel. But if that person who would suddenly have symptoms, he will go to that isolation area. He will then, of course, be properly assessed by the medical personnel or any clinic personnel who is assigned to assess this person, this worker, who suddenly might have any symptoms. And if they would require transport, and this is where we would always tell you, please have already a referral system to a hospital or a healthcare facility, so that if they need to be transported, then it is really a matter of just arranging it. It's so hard and it was asked of us, will we use our own company vehicle? If there are symptoms, really, what we would have that you already have arranged such transport with the nearest health facility, so that the person will be properly assessed and properly managed. Now, remember, for if there are symptoms, and this is in the guidelines, the test that would be needed here would be PCR. I will give you a short, after all of this, our discussion with the DOH on the return to work testing. I think some of you were with us when the DOH discussed this with the DOLE and DTI, and I will be using the slides that was also shared with us by the DOH.
Okay, thank you, Doctor.
Now, for decontamination of workplaces, remember, there is someone who was unwell. So he did come from a workplace. He did come from work areas. So there should be decontamination that should be done wherever that person came. I mean, where the person came from. And if it is a large area, you might really want to decontaminate perhaps even a big portion of a building or the work area. And then, but work can then resume after 24 hours of decontamination. And this is very important, all co-workers who were exposed to that suspect should also go on 14 days home quarantine. We wrote there that if that worker tested negative, then they can go back to work. But please also note that there should be proper assessment, because if you feel that he might be testing negative, but you might, in terms of assessment, you still would want the other workers or even the suspect himself to still go on quarantine. It is really left to your best medical judgment. Now, if it is an infection arising from not because of COVID-19, we still tell our workers, please continue to stay at home, keep away from crowds, take adequate rest and plenty of fluids, continue to practice personal hygiene to prevent the spread of disease. And should there be any COVID-like symptoms, then they should seek appropriate medical care. But in the first time, in the first sign of any symptom, if you have telemedicine, and this is where it's really very important that as PCOM, and I think I've seen it in your website, in the Viber groups, that you're really promoting telemedicine. That is something that is very important now, so that those who are unwell, they do not have to physically go to clinics and are duly exposed. But through telemedicine, you can be able to at least advise the workers on what, or those who are not feeling well, on how they should properly manage themselves. In the guidelines, we also wrote employers' duties, which would mean the company policies for the prevention and control. We are not asking that you submit this, unlike the one in as written in 198, but it would be a very good policy because that it is written so that all the workers know that you have policies and programs that address the risks from COVID-19. I have seen the surveys run by the ECOP, and health risks are really a priority concern. So one way uh, for for you to tell the workers, look, we have these policies. We have this policy that you should wear masks or disinfect. These are very good, and please have it written. If you want to submit to us, fine. But we're also trying to avoid, bottlenecks. Um, you want to share it, that's also well and good. But we also would like that when you already are looking into your advocacy and IEC programs, we would like that you get them from reliable sources. Resources and materials needed to keep the workers healthy and the workplace safe are duties of employers. The provision of masks, the disinfectants, the soap, uh, um, even the test kits, if you would like to have your workers tested, that is still the duty of the employer. Safety officer should be designated, safety and healthy, sorry. The safety and health officer should be designated to monitor COVID-19 prevention and control measures. Other duties, health insurance provision. This was uh, the the reason that this is written here is, definitely PhilHealth will be they already have a package for COVID-19, and if it is work related, because it can be, the EC will provide as well. But we also know that the costs can really run into a big sum. And because of that, if companies can provide more insurances for their workers, then it would be a good measure for them to do. Shuttle services, decent accommodation, these have always been there already with the ECQ, because there are companies who are allowed to operate in the ECQ, and because there was no transport, public transport was really stopped during the ECQ, and that's why they resorted to having shuttle services and decent accommodation. We're still continuing this. If they can, that would be good. And that, you remember, even in the GCQ, there is still limited transport. So if they would like to provide, that would be very good. So together with accommodation, if this can still be provided for. And so that, it will also be less in terms of transport concerns, we would like companies to hire from the local community. And again, as part of consultation or a referral mechanism, if you can already have a COVID-19 hotline or a call center for any of your employees to ask anything, especially on things that are bothering them from COVID-19 or any questions, please have this set up. The workers' duties would, of course, to be comply with all the measures for the prevention of and control, mask, distancing, frequent hand washing, the respiratory etiquette, the cough etiquette, and of course, proper waste disposal. On COVID-19 testing, what is written is that employers may. We did not say they should, they may. It is really, it is a call for the employers if they want to. And then I will now go, later on, I will discuss this a bit further. I'll just finish the guidelines. However, if they will do that, there are many administrative orders or memo orders of the DOH that must be complied with. The first would be on the guidelines for expanded testing for COVID-19, which is the 2020-180, and their administrative order 14, which would be on the operating COVID-19 testing laboratory, but this is more for the PCR. The second one was looking at the 2028 0180 is looking at the rapid antibody test. The guidelines, of course, talks of the most at risk workers and vulnerable groups, and the most at risk would be those 60 years old and on above with comorbidities or of any age with comorbidities or pre-existing illness. And again, it has always been repeatedly told to us that we would, it would really be best that they would do work from home type of arrangement. There are many ways now, even in the civil service, they have like a blended approach, like a few days to go, or even a few hours in a day, or and a few hours in a week. But actually, you would, there were so many complaints from these senior citizens who said, we are even healthier than the younger ones, why can't we go out? And then we were, even the interagency, they were trying to explain why they were vulnerable, why they were at risk, especially because they can be the ones ending with a severe and critical illness. But then, of course, if they still feel they would like to go to the work premises for certain hours, then they can look at that. But we really were encouraged that they do work from home. And if there is work from home, so that the companies will, and they look at it as a working arrangement, there should be deliverables, and those doing work from home should, of course, be delivering these outputs when they do this work from home arrangement, because in these types of setting there should be no diminution in wages or benefits. DTI and DOLE shall extend assistance and technical support. There is really no financial support that we can further give, especially after our own financial assistance for the workers. But technical support, like is there any assistance we can provide with looking at layouts or how they can still look at their workplaces? The DTI and DOLE, we can work with them. And all employers shall report the any illness, disease, and injury utilizing the DOLE work accident and illness report form. As an annex, you all gave, this is a sample protocol. Actually, this is going to be used in the DOLE, and we just use this so that this is how we're going to screen, like for temperature. When will we assess that they can come in because it's at that a temperature that we are comfortable with, or they should be further assessed or not allowed to enter at all, and given the proper advice though. Then the health checklist, which is looking, of course, at the symptoms referable to COVID, which is more respiratory. You can add more because as we discover as we have more knowledge now on COVID, it's really up to you. This is really a sample. But if you would like to add anything more, we leave it up to you, but as long as, of course, it's evidence-based. But here we also ask very important questions like, have they been staying, or was there any exposure to a COVID-19 case, or with anyone with symptoms that would be COVID-19 related, or a travel? Of course, this has always been one of the big factors to consider, travel outside the Philippines. But now we're also looking at travel in places in NCR which would have a high incidence of COVID-19 and would be possible exposure. These are just screening so that the person can be properly assessed. And like I said, we are trying to isolate so that we are just making sure that there would be no undue exposure for the many other workers in the workplace. And I think, yes, that's the end of the presentation. Now, before you ask anything, let me finish, and I will share with you the DOH return to work.
May poll questions tayo, dear participants. Please kindly answer all those, and probably we can start for some of the questions that we have here. So we have one here by Dr. Jose Angelo Taylor. So is there, Dr. Cucueco, can you already answer?
Yeah, sure.
Okay. Is there any guidelines or protocols with regards to the minimum health requirements for a worker returning to work? Meron ba tayong minimum, Doktora? Paano yung may mga comorbidities or pre-existing pwedeng wag na silang papasukin, mga
Yun na
ganito.
yung minimum. No, these are really, I mean, in terms of return, I mean, now that they're opening, how
Yes.
how are you going to look at your workers in, you know, if you're allowing them to go to work? Is that the question? Ganun ba yun?
Yes, parang may minimum
Oo.
ng health requirements ba ang ating worker, or dapat yung mga tipong yung susundan pa rin natin yung COVID protocol na no fever and so on and so on.
Yes. That's really the no symptoms, that that they're well the past 14 days. Those would be, and you and you, that you would not need the test. You know, that's why in Sayang, if you can open the slide that I sent to you, that would be very good, because that's looking at
Dr. Isi, you're doing something about it, right? As we go over with the questions here, right?
Yeah. Doctor, I sent you an email.
You did?
Ayan, okay.
Sige.
Multitasking tayo, Dr. Cucueco. Yeah, well, she's
go ahead while I look at your...
Sige, Doctor. Another question is with regards to the rapid test, wherein companies are using it as a clearance, as return to work. Will there be any guidelines using it as a basis for return to work? Or otherwise, due to the rate of the false positive and false negative, we'll still go for the PCR. What can you say about it, Doctora? Or
can you repeat it, please?
Okay. With regards to the rapid test, wherein some of the companies are kind of like encouraging it as a clearance for the return to work. Although, are we expecting a protocol using the rapid test, Doctora? Or it's still PCR pa rin? Paano po ba ito? Nakakagulo, Doc, eh.
Nga, nakakagulo. Pati yung binigay ko kay Easy, it couldn't open. Sorry, I really have to say it, because, you know, it's like everybody has to, but, I am trying to... Okay.
Okay, Doc. With regards to rapid test first, Doc.
Rapid test is not really especially if it's the first test to be done in any workplace, sabi nga ng DOH, and we're still waiting for the guidelines, is that please do not do rapid test, the antibody test as your first test. They would really rather have you do the it's RT-PCR. And then if you want to do, and they say, please do not, if you, it's more of getting a sample population, because it's, as they have always said, there will be many false negatives, especially if you have no symptoms. But that does not mean to say you are either pre-symptomatic, or you might be on the pre-symptomatic stage where your viral load is not that high yet, but then you will still develop COVID-19, but you tested negative because you were tested on a time where the viral load was low.
True.
So for both the RT-PCR or the antibody test kit, that's why they were saying, just make, you should understand the limitations of these tests. These tests are not going to be your absolute answer to everything. What they're saying is, if you do not have any symptoms, you are not exposed 14 days, and you are well, you are cleared for work. But if you or your company says you, and we say naman in the guidance they may, what we're saying here then is, please go ahead and do a sample population. The first would be RT-PCR. After 14 days, you can now do the antibody test. Okay. But remember, that would be every 14 days. You will be repeating that antibody test, not for the same workers. They could be for different workers, or you might, it's really up to you on when you would like to stop, but it's just giving your workers a sense of, I don't want to say security, but it's just telling your workers, we started with the RT-PCR. Now we're doing the rapid antibody test, because, after 14 days, diba, that's where the value naman of the rapid antibody is when you start seeing the IgG.
Yes.
But, definitely if you see an IgM and they have symptoms, but then ang ano nila dito is then if you're doing rapid test and you have that, what is also still required is that you should do the RT-PCR. So that's already 2 tests again. So please understand really and then it's in the expanded rapid test administrative order anyway on how you should interpret all of these tests.
Right.
So it's we again, that's why the DOH is saying make sure you understand that when you are going to use this, you know what what you're following, and it's not going to be the um the end all for saying that your workers are healthy. What will really be helping you would be that they have no symptoms, that they have no exposure, and once they feel unwell, then they should consult. So all of this really, kasi we're all doctors here, and you will have to have all of these are now under your care, and looking at all the workers, all of this have to be taken as a whole, and not just the test.
Are we going to be expecting a protocol for using the rapid test, Doctora, or
the rapid test is already there? I showed that to you in the
slide.
In that slide, in the earlier slide, where the DTI, the Administrative Order 2018 yata, was on the testing. So please understand that administrative order of the DOH. On the return to work testing, they said they will be giving us guidelines that we will share, of course, with you. And actually, when it's out, everybody can then access that. But we're still waiting for that. And they said they will also give an algorithm together with it. So if I can't open the slides, then you just have to wait for it. Or maybe I'll send it to you when it's a lot better. I just don't know why I can't. I'm sorry, I wasn't able. It's not working. It's not working.
Okay, sige. Habang inaayos pa, Doktora, yung slides.
Yes.
There's another question again here. Medyo mas technical, Doktora. Shall we report to DOLE through what year? Those employees working from home who would contract the disease, even though we feel that it's not contracted from an employee, but probably outside? Is it still part? Because the person working from home is still, part of the company. So kasama po ba siya sa pag-report sa WAIR, Doc?
Kasi worker pa rin naman siya, di ba?
Yes, Doc.
You can always put a remark. You can always put remarks there anyway. But remember, COVID-19 is notifiable and so you still have to report that anyway. Now, whether if you're saying, because it's not from our work anyway, but from somewhere else, you just report it. The DOH naman will then validate all of this information.
Okay. There's another question, Doctora. If ever po, Doc, in preparation, with all the preparation of the company, can the employee invoke his right to refuse to work kasi feeling niya unsafe work due to COVID and ECQ?
Alet, sorry kasi I'm really trying to bring you the slides. I'm using now my phone. Okay, alet, yes.
So, halimbawa, meron na tayong mga in place na mga protocols and guidelines sa company, and still the employee feels that hindi pa rin siya safe sa tingin niya, can he refuse work?
Okay.
Yes,
sa ating it's why this is where sometimes the policy should come in, especially with HR, when they draw up why. But really, there is the fear is there, but there is a need for people to get to work, and you are putting all these safety guidelines in place so that doing everything you can. They know that their risk will be not high, will be lower, so that they can now. Ayan. Thank you.
I'm so happy. Very
good. Can we start with slide 1?
Yes, go.
Na siya.
Thank you so much. Galing. From PCOM QC siya.
Sige. Ayan. Sige, ikaw na, Doktora. You please another slide.
Okay,
So,
Doctor,
sige. I'll park that question, but let's just go to this one. The return to work protocol and testing.
Yes, go ahead, Doctor. Just say next. If you need
say next slide. Kasi I think you're the ones, you're the ones already who can, yan.
Good, go.
Okay. Go back. I think it has a mind of its own. Okay, if you can hold it there. This is a priority that was given to us. Of course, what we all want, especially in workplaces, would be to prevent. And it will still happen that there might be cases that might arise. That's why we trace and monitor for symptoms. And if it would be a COVID positive or a worker with COVID-19, there would be quarantine either in facilities like the hospitals or other quarantine facilities, or home quarantine, which would be not just for the COVID-19, but even for those with those close and other contacts. Then for symptomatic, look at the symptomatic and close contact, it's test with RT-PCR and isolate. And of course, if there are symptoms, whether mild, severe, you really have to manage the cases. Next. Prevention is really cost effective, and that is why the strategies here would be to actively monitor the health status of the employees, the temperature, as well as the symptoms, to create a safe working space. And that is what we would really try to tell our workers. To the best means that we can, we are creating this safe working space through physical space, time distancing, and regular cleaning or disinfection. And because there will be leaves, this is what the DOH has proposed, and we are waiting for that so that we can propose this to employers. Compassionate policies looking at leaves and sickness. And if, of course, if there's COVID-19, they should, or close contact, there should be cooperation with health authorities and reporting of their office surveillance data, as well as the when workplace closure has to happen because of this infection, then they work together with the health authorities in the area. Next, please. Okay. This looks at the tests. The first is screening. The questions: fever, respiratory symptoms in the last 14 days. No. No test needed, they're cleared to work. If yes, isolate and test with RT-PCR. If positive, of course, isolate and treat according to that is a COVID-19 case. If negative, it could be COVID-19 negative, really, or a false negative. So they're saying, because it could be a false negative, just complete the 14-day isolation. And that's why even for the close contacts, because it might be a false negative, they would still like you assess properly so that you will still complete the 14-day isolation. You are really trying to isolate so that you err with caution, but then you really are at least putting, then when they go back to work, then you know that they are now free from COVID-19 if it is a false negative. Next, please. Testing the asymptomatic, and this was what I was telling you earlier. The employers may conduct a test representative sample dependent on the company's population. So you have that formula done, determine the proper sample size if your companies really are so insistent. But remember, RT-PCR, we still have constraints on the supply. We do not have, I know there is so much, I don't know, but then we are also, they're also meant for the symptomatics as well as for the suspects and the probable cases. So, but the first test that they're saying is RT-PCR. Then every 14 days with a rapid diagnostic test. And please, that is why, please read this department memorandum of the DOH 2020-180 because that gives you the protocol on rapid test. And the cost of testing shall be borne by the employer. That has always been there. It is also in our guidelines. The testing for representative asymptomatic employees using RT-PCR is not cost effective. I think it's 3,000 pesos per test, and the cost of test shall be borne by the employer. 3,500 daw at PRC. Thank you. Next. In summary, symptoms and exposure as entry points for screening cannot be overemphasized. Test using PCR only, priority is symptomatics. The non-pharmaceutical intervention, the whole guidelines that I shared with you, is of utmost importance and should be implemented. And then the last slide is, I think that then we have one more slide. That's it. So the hotlines are there, the telemedicine numbers are also there. So, you know, when you go back, you can put that for your companies also in reference. But that is it for testing. I hope we are clear, because I have seen even in your Viber groups when you are discussing all of this, and I said, and I'm glad I was able to share this with you. So let's go back to the question where we are on if they don't want to go. Remember, as best as we can, we're already trying to create that safe space. And if they won't, there should be policies really. And if they have no comorbidity, kanina we were also having a video conference with the employers group. And it is already our DOLE lawyer said, no work, no pay. So we go back down to that. And if there are other policies that would have other disciplinary actions, just make sure the workers understand that there are all of these policies in place, so that they can all, and that you are also creating that safe working space for them.
Okay, with regards to the disciplinary actions, Doctora, if I may ask this question, will failure to conduct health symptoms checkup or questionnaires for employees and visitors that were provided by the DTI rendered by the company as non-compliant with OSH or DOLE standards? Halimbawa, mga walang questionnaires, hindi talaga following the rules with regards to the COVID-19.
Si employer ang ayaw.
Opo, si employer. What are the possible consequences to the company for its failure to adopt or adhere to such guidelines, if any?
Okay. Kasi that has been asked. What if companies will not comply? You know, okay. This is safety and health. On penalties, you have the penalties written in the OSH law and then given in the 198. These are non-compliance, and they can be penalized. But that is if there is willful violation. When the guidelines were developed, we also, at this point, so many companies are really suffering. And that's why we tried to veer away from penalties, but we are more of, we will assist. Ano bang mahirap pa sa what is so difficult in what we are asking you to implement? Kasi if it is just a matter of how to prepare all of these questionnaires, and then we will extend all assistance. But again, if they still do not want that, they still will not comply, then there are these penalties that can happen. But as much as possible, sabi nga namin ng DTI, DOLE, the complaints will come to us. We will throw it to DTI so that DTI will, because mas nila sa industry, so that they can really work with industry and tell them, please comply. There are reasons that we are asking this, so that at least workplaces are rendered healthy and safe. But if not pa rin, then I already told you the penalties are there.
Thank you for answering that question. Now we have a raise hands question here, Doctora. Siya ang ilalagay ko para siya po ang personal na mute ko na po. Si Gilmore Tongko. Go ahead. Are you a doctor, Dr. Tongko? Hello? Hello? Okay, go ahead. Let's unmute him. Go. Where is he?
Baka naman tinype na niya yung question. Kasi chat.
Yes. Dr. Isi, can you unmute Dr. Tongko, please, so he can ask Dr. Cucueco his question? Okay. Unmute. Nawala siya. Okay, sige, Doktora, habang wala pa, I'll ask this another question, Doc. Sa company po ba, sila po ba ang dapat nagbibigay ng PPE natin, Doktora? Is it mandatory for companies to provide face mask, sanitizer to all employees?
Yes.
Okay.
Yes.
Oh, matigas na yes yun, ha, ladies and gentlemen.
Pero nakakatanggap na nga kami ng ang mahal-mahal na niya.
Yes, pero parte na siya ng ating new normal, di ba, Doktora?
Yeah, that's true. We have to.
Now, can we insist that immunocompromised employee in health risk or vulnerable category work from home, even the employee opt to work in the office instead? Pwede ba namin insist, wag ka nang pumasok? Paano po ba yun, Doktora?
Because you have to clear him kasi.
Yes.
And if you cannot clear him, you just have to, at least create, and then that's why we appeal to companies, have a work from home, a good work from home arrangement. Because if they also feel that they can, they're productive even doing work from home, and you're adopting this arrangement for his health, for his safety and health, then he should comply with this. He should also understand why you do not like him to be unduly exposed, because he might really suffer from those with severe and critical symptoms.
Pwede ba niya tayong balikan, Doktora? Pwede ba niyang balikan yung company and say, nako, I know I'm healthy, dapat papasok ako, pero even if...
Hindi ba, hindi mo nga i-clear kasi nandun naman yung sakit niya.
Okay. Thank you, Doktora. Now, pwede po bang magamit ng companies yung non-FDA approved na rapid test? Kasi may question dito, Doc. Pwede ba nilang gamitin na nabibili online?
Alam mo, tingnan nyo yung AO. Nandun na memorandum order. It should be FDA approved. Actually, if they even, it should even be validated. But then nandun na it's FDA approved.
Okay. With regards to that as well, Doktora, can they also, pwede po ba na yung mga company clinic po, ina-administer ang rapid test kit, or need po ba na dapat sa DOH accredited facility?
And that was also brought up with our discussion. I think in that memorandum order, you will see that doctor lang okay na siya.
Doctor lang. So, pwede na po.
Pero dapat naka-PPE yan, ha?
Okay. Oh, yeah, Doktora. Thank you for that clarification. So, pwede na yung doctor ng company?
Yeah.
Okay. So, they can buy na. Yung sinabi niyo po kanina na mag-random or may pinili.
PCR sa una, ha?
Yes, PCR. And then another group of that company can do a rapid test.
After 14 days, yeah.
Okay. Thank you po, Doktora. And those who will be quarantined, who already consumed their leaves, will the leave be an additional paid compensation?
Okay, let's if it is a mandatory quarantine, and the DOLE already issued an earlier advisory on this, or a clarificatory advisory on this. If it is a mandatory quarantine because you are, at the time, PUM pa, tsaka but now it's suspect because you were exposed to a case, you are not, the company should not deduct from your sick leave or vacation leave, and it is a leave with pay.
Thank you, Doctora, for that clarification. Now, we'll see the poll questions, but pag hindi pa natin to makikita yung mga poll natin, no? Kasi limited na. Ito na pala. Thank you, Doc. What industry? Say share na natin. BPO. Okay. Ito na po. Nasagot po tong easy. Ito na ba lahat yung ating sa sharing poll results natin for Dr. Dr. Cucueco Perusal? Ito na siya.
Okay. So, marami pa rin manufacturing.
Opo, marami po. Now, kung may mga tanong pa kayo kay Dr. Cucueco, please email us na lang kasi limited din ang time natin. It's already 8:15 para hindi rin po natin si Dr. Doctora, thank you so much for having us, Dr. Cucueco, for your
Okay.
time and sharing all this knowledge for with regards to our new normal and our return to work OSH po, no? Salamat po. Doc, mayroon po ba kayong parting words for us?
Please always because kaya interim guidelines to, because if the DOH will come out again with any guideline that would have bearing on the workplace, ito yung sasabi namin sa guidelines, it can supersede.
Okay.
So we will also naman share with you if there will be any guidelines that will have that will affect workplaces. We will share that with you. But again, because of so many discoveries, these are so many unknowns that we're having here. But if there would be any newer issuances, we will all share this with you. But if you have any questions, just feel free. Even in the BWC, we already developed a FAQ there for COVID-19. We put on already FAQs. But if you want to ask pa, we will also go there to also answer your questions.
Okay, thank you so much, Doktora. Opo, salamat po sa oras nyo and everyone na nag-participate tonight in our 15th OHH Kapihan. Salamat po. Sana sa susunod uli naming webinar, we will be participating again. And if you have further questions, again, you can email us. Ilagay namin sa dulo po. Is there any other questions? I think wala naman na yata po. Thank you again, Doktora.
Thank you to all of you who were so patient.
Yes, salamat, Doktora. Kayo din. Ako, binigyan nyo kami ng chance to ask our questions po, no, na medyo may mga talagang issues, especially the use of the rapid test and the RT-PCR na nakaka-confuse. We'll be expecting ba protocol about it, Doktora?
That's what the DOH, and we will share that with you as soon as they share it with us. But what I shared with you, please thank Yusek Vergere for this, because that was our discussion, and we're using that now to also give you. And see, Dr. Savannah was also, of course, he was our resource person, and with the DOH.
Thank you so much, Doctor. In behalf,
thank you. Nice to see you.
Salamat po.
Stay
Ikaw
safe.
Stay healthy.
Thank
you everyone, and have a pleasant evening. Salamat po. See you again. Stay safe.
Stay safe.